Good evening, doctors. My name is Ankur Gautam, and on the behalf of FDC and Med Talks, I welcome you all to yet another episode of Diabetes Essentials with Dr. Sanjay Kalra. Today's topic is very interesting topic: coping skills training. So today's session is brought to you by your zero calorie electrolyte drink in Result Zero. Now, before moving forward, I would like to announce last week quiz winners: Dr. Shantanu Kumar Bhattacharya from Kolkata, Dr. Nakul Bansal from Panchkula, Dr. Devraj Bhai Dholaria from Surat, Dr. Bharat Praveen Mittakota from Surat, Dr. Anand Purande from Mumbai, Dr. Tanmay Maitra from Calcutta, Dr. Manoj Singhvi from Mumbai, Dr. Ravi Bhatt from Sirsi, Dr. Ashwani Kumar from Kanpur, Dr. Rinku Gupta ji from Mumbai, Dr. Sarfraz Arju Sheikh from Mumbai, Dr. Sanjeev Puri Hoshiarpur. So thank you all the doctors to take part in the quiz. Now to enlighten us regarding today's topic, I would like to welcome Dr. Sanjay Kalra, Chairperson Education Working Group International Society of Endocrinology and past President South Asian Federation of Endocrinology Society. Over to you, sir.
Thank you, Ankur, and warm welcome to everyone. Like as always, it's great to meet friends every Sunday evening. Welcome to Dr. V.K. Goyal, Dr. M.A. Lambe, and Dr. Anshul Singh. Now, today is a very important topic, something that is close to my heart. And Dr. Vinay Tasai asked googly dystonia ataxia. Okay, let's come to that. Now, this is a topic which is important, which is necessary for all of us in each and every sphere of life, whether we think of medicine or whether we think of non-medical issues. And now let me try to find my slides. Our topic for today is coping skills, and we'll talk about how to cope with stress. Now, all of us face some kind of stress or the other at each and every point in life, isn't it? So, uh, similar thing occurs with people living with diabetes, and we have to teach them how to cope with stress. This is known as coping skills training. Coping skills training. And how can we train someone to cope with stress? The only way we can do it is if we ourselves know how to cope with stress. So that's what we'll try to do today. Why do we need to focus on people with diabetes? Because many a times they come in with something called diabetes distress. They have symptoms suggestive of anxiety. They have symptoms suggestive of depression. But if you were to apply the diagnostic criteria, they would not fit into major anxiety disorder or into major depressive disorder. So they have the symptoms, but you can't classify them as having diabetes or depression or anxiety. So therefore, you can't treat them with an antidepressant or an anxiolytic. Neither do they need that. The reason is that they have another condition, which is called diabetes distress. This is an emotional condition, not physical. It is emotional. It is characterized by extreme. Note the word extreme. Apprehension, discomfort, or dejection. Apprehension, fear, discomfort, not feeling happy, not feeling comfortable, dejection, sadness, sorrow, extreme, due to a perceived, note the word perceived. They self perceive that they have an inability to cope with the challenges and demands of living with diabetes. So, when you're diagnosed to have diabetes, when you're diagnosed to have a complication of diabetes, when you are given an intervention which intrudes into your lifestyle, that intervention may be 2 tablets of metformin, it may be 4 injections of insulin, it may be an insulin pump, it may just be checking glucose once a week or twice a week. That is a challenge. The demand is that now you have to learn how to use the insulin. You have to learn how to use the glucometer. You have to learn whether to take metformin before meal or after meal. So you feel that you may not be able to cope with all this. You perceive that. Because of that, because of that perceived inability, there comes a feeling of apprehension or discomfort or dejection. If this is extreme, then it is known as diabetes distress. This will impair not only psychosocial health but also biomedical health, because then people don't indulge in self care, in self management. They feel afraid, and so if we want to achieve good and optimal outcomes, we have to manage diabetes distress. Now, see the etiology of diabetes distress: a perceived inability to cope. That is the etiology. So now, once we understand this perceived inability to cope, what we have to do is we have to improve coping skills. We have to help the person improve the way he or she copes. It's not only about he or she or they or them, it's about everyone, the healthcare team and the family as well. So, if we are able to teach our individuals, our patients, their families and caregivers, and also ourselves how to manage diabetes related stresses and challenges, we are through. Our work is done. So, that is why coping skills training is essential for practice. AEIOU method, we'll talk about different structures, different rubrics today. AEIOU method tells us that, first of all, A, assess the coping skills. How is a particular patient, a particular individual coping with stress? The negative coping skills, then you have to eliminate them. Assess them, point them out, acknowledge them, and then eliminate them. Tell the patient to get rid of them. But if you get rid of coping skills, you have to have something to replace them. So at the same time, you introduce and you internalize. Introduce and internalize positive coping skills. So first, do a diagnosis, eliminate all the bad wood, the rotten wood, introduce and internalize positive coping skills, observe your patient continuously on an ongoing basis, and help the patient upgrade his or her understanding. AEIOU is a lifelong process. When I look at it myself, if ever I am faced with stress, which is quite frequent, I first of all usually go into negative coping mode. Then I assess myself, eliminate the negativity, accept what is going on, move on to positive mechanisms, observe myself, and keep on improving myself. And that is the way life continues. What are the negative coping mechanisms and what are the positive ones? So four negative and four positive coping mechanisms as per this um, construct. And we will have different constructs. You can use whatever you want in your OPD, whatever suits you. Negativity, thinking bad thoughts and extreme thoughts. So I have got diabetes, uh, how bad it is. Thinking extreme, I have got diabetes, now life will come to an end. I will not survive at all. Thinking bad thoughts and extreme thoughts throughout the day, 24 by 7, you are stuck in a negative rut of diabetes, diabetes, diabetes. These are negative coping skills. Also, blaming oneself. It is all my fault. Maybe in previous existence, I did something wrong. That is why I have got diabetes today. Or you blame others. My friend made me drink Coca-Cola. My friend made me take alcohol. That is why I have got diabetes. So you put all the blame on someone else. Or I went to the doctor. That doctor is known for diagnosing diabetes in everybody. So until I went to the doctor, I did not have diabetes. The moment the doctor pricked my finger and used the glucometer, I got diabetes. It is all the doctor's fault. So thinking bad and negative thoughts in extreme and 24 by 7, these are negative coping skills. Blaming oneself and blaming others, just going into blaming mode, that is a negative coping skill. From here, we have to come to neutrality, which is acceptance. Just accept that you have got diabetes. Accept that a family member has got diabetes. And then we come to four positives. So put in perspective. Okay, there is diabetes, but uh, it is curable, it is manageable. At least there is a treatment for it. 100 years ago, there was none. Put in perspective, okay, there is diabetes, but my limbs, my hands, my brain, everything is working. I can continue working, I can continue living. So why should I be sad? So put things in perspective. I have diabetes, okay, but the doctor told me that my cholesterol is normal, my kidneys are normal, my liver is normal. So why should I worry? P is also for positive spin-offs. Okay, I have diabetes, as it is, everybody at home was telling me I am not living a disciplined life. Now maybe this will help me follow discipline. I had been thinking of so many lifestyle changes, but I was never motivated enough to do them, to follow them. Now I am motivated. That's a positive spin off. It's the second positive coping skill. Putting in perspective was the first, positive spin off is the second. The third is pleasant thoughts, things nice, nice things. The weather is so good here in Karnal. It's spring for us. In at home, we have a mulberry tree. The mulberries have started flowering, and another couple of days, and we should be able to begin eating those mulberries. Mulberries are very tasty. The only thing is when you harvest them, your hands become dirty. So maybe next week you will see me with violet hands, just like we have this violet color for positive today. Uh, so think pleasant thoughts, nice things. Go to the theater, go with meet a loved one, telephone a friend, go for a walk with someone. Do anything pleasant, anything positive. That's the third P. And the fourth is plan for the future. Okay, the doctor told me that my EGFR has come down. I may need a dialysis in future. I may need a kidney transplant in future. Let me begin planning. Let me find out who the right doctor is. Let me save money for this. Let me get a health insurance plan. So there's another positive coping skill. So from negative, extreme and bad thoughts and blaming oneself or others, you move to neutral, which is acceptance, optimistic acceptance, and then you move to positive peace, putting in perspective, positive spin offs, pleasant thoughts, and planning for the future. This is one structure that I follow in the OPD. And here, acceptance is the key to moving forward. Another structure that I followed is what we call the 15S list. Here we have 15 tips and tricks which are structured into 5 domains. So we try to harness the power of thoughts. From thoughts, we get words. From words, we move to planning and then motivation and action. So, this is a traditional Indian philosophy which says that if your thoughts, your words, and your action, if your thoughts, your words, and your behavior are in concordance with each other, then you are living a life of harmony. And this is actually true. Whatever you think, whatever you say, whatever you plan, whatever you do, if all these are in concordance with each other, then life is fine. When there is discordance, for example, you think that your boss is a very khadus or a very grumpy kind of a fellow, but in front of the boss you say, good morning sir, good morning ma'am, how nice you are, how good you are. That is discordance. That is not harmony. If you are telling somebody how beautiful you are, how handsome you are, but your planning and action is different, then there again there is disharmony. So we realize that all these 5 domains that we have should actually be concordant with each other. Let us look at these again. What does the power of thought say? For people living with diabetes, just follow your sixth sense. Your sixth sense is meant for survival. So focus on survival, sixth sense. Move from self pity to self esteem. I am a creature made by God, and of course I will be successful. Otherwise, why else would have God made me? And see the sunshine, find positivity wherever you go. I learned a new word recently in English, apricity. So, city means, of course, like city or town, urban place to live in. Then, apri is from apricot. Apricot is a tasty fruit, but apricity means the warmth of the winter sun. So that is what we were experiencing in Karnal last month. We had apricity, the warmth of the winter sun, and that kept us going. So see the sunshine wherever it is, wherever you find it. So sunshine for me today is that I learned a new word. The power of words as well. So find strengthful synonyms. Begin using positive sounding words. We'll talk about that. Use humor, self humor. Don't laugh at others, laugh at yourself. And use the scale of numbers for the theory of relativity. Okay, my HbA1c is 12. At least it's not 13, so it's better than that. See the theory of relativity. From thoughts and words, you move to planning. So when you're planning to live life with diabetes, you have to seek information, search for exceptions, search for people who are successful at living with diabetes, search for people who are successful at treating diabetes, search for solutions as well. So help your patient do this. Let them get whatever information they require from you. If they're not able to, you refer to the right colleague. So from thought, we move to words and then to planning. But planning alone is not going to help us unless we are motivated. So motivate your patient with stories of success, with peer support. So, stories of success and support systems are important, and sometimes spirituality helps. There is a slight difference between religiosity and spirituality. The Urdu words are mazhabiyat for religiosity and ruhaniyat for spirituality. In Hindi, religiosity is dharmikta, and spirituality is adhyatmikta. So there is overlap, of course, but there is a difference as well. And focus on spirituality. In case it works for your patient, you can focus on religiosity as well. That is a very good coping skill for those who believe. And all this leads to the power of action. So action, help your patients prioritize sensibly. Move step by step. Okay, today let's learn how to take insulin. Tomorrow we'll learn about foot care, and day after tomorrow maybe about glucose monitoring. Go step by step. Don't overwhelm your patient. and help your patient remain safe by understanding whatever potential challenges, barriers may come their way. Teach them how to suspect and anticipate a particular challenge, and then how to face it with equanimity. SAFE, remain safe. For example, hypoglycemia. Teach your patient how to suspect and anticipate hypoglycemia and how to manage it. A drug which may cause GI disorder, which may cause GI dysfunction like nausea, vomiting. Tell them in advance. You may have nausea, vomiting, reduction in hunger. Don't worry. If it happens, that means the drug is acting. Face it with equanimity. If required, you can take such and such a folk medicine or such and such a tablet to reduce that. So see this 15S list, a very powerful list. Harness the power of thought, words, and action. But you can't reach action directly. You have to harness the power of planning and the power of motivation as well. We spoke of positive P's, and earlier we had spoken of 4 P's, but here we have 5 P's now. So, apart from pleasant thoughts, putting in perspective, finding the positive side of the coin or a positive spin off, and also planning, another coping skill is partnering. So, partner with people around you. There is a lot of support around you. Just find it. You might find it from the doctor, from family members, or from non governmental organizations. If you don't have money, maybe the local church, the temple, the Gurdwara Sahib will help you. So do reach out. Go to the government hospital. You will be pleasantly surprised. They may have a budget for insulin for you. So this is the pentagon of 5 P's that we speak about. We also said initially the power of words, strengthening synonyms. So use words, synonyms which are positive, like specially abled, living with diabetes, instead of disabled and suffering from diabetes. Empathy instead of sympathy. Diabetes is a part of life, it's not an unfortunate incident. Use challenge instead of obstacle, overcoming or coping instead of struggling, preventing complications. We are giving medication in diabetes to prevent complications, not to treat complications. And speak about promoting good health, speak in a salutogenic or health oriented manner. Instead of talking about lifestyle restrictions, you talk about enhancing lifestyle and talk about diabetes control, diabetes drugs as a blessing or as a support. To do all this, to use these, to harness the power of thoughts and words and planning and action, you need motivation. So motivation will continue throughout, non-stop. We ourselves need to be motivated. For me, one very important source of motivation in my life is these Sunday meetings, the FDC Diabetes Essentials. They motivate me to do my best actually for diabetes care for everyone living in our country. All this, we have shared 2 rubrics so far. One was the 4 plus 1 plus 4, where the one is acceptance. Then the other one was this power, the 15 S's. All these are possible if you are able to assess coping mechanisms properly. So we did talk about assessing negative coping skills. One validated tool that we have is the glucocoper. This is actually quite simple. It categorizes styles of coping into 2 negative and 4 positive mechanisms. This is validated, and this is how it looks like actually. So you can take printouts of this. Uh, Negativity and blame. These correlate with our negative coping skills. So you ask your patient, how often do you get stuck in extremely negative or persistently negative thoughts? Are you always blaming yourself or someone else for diabetes? On a scale of 1 to 10, why don't you rate yourself? If the numbers are high, it means the patient is in negative coping. And if the glucose level is high, probably there is a psychological cause for this, a psychosocial cause for this. So fix that. From here, you have to move the patient to the second line, which is acceptance and optimism. Ask the patient, do you accept diabetes as a part of your life? Are you optimistic? If not, promote it. Madam, now we can't change life. We have to accept diabetes as a part of our life. And you should be optimistic. Once you've achieved that, then you take them to planning and action. How are you planning for diabetes care? And actually, what actions are you taking? So, see this hierarchy. Move from negativity and blame towards acceptance and optimism, and then towards planning and action. If your patient is stuck at negativity and blame with high numbers, there is no point in shifting to action. It is just not going to work. From negativity and blame, you have to first bring your patient to acceptance. optimistic acceptance, and then you move on towards planned action. If, however, your patient is already accepting, then you say, yes, we are here, now we are together as a team, we are optimistic, let's move straight to planning action. So, this will help you sort of find where your patient is in the journey of coping. If there are ups and downs, you know what has happened, you know how to take a history. If your patient is in the red zone, take a good psychosocial history. If your patient is in the green zone, then and glucose is still not controlled, then you take a biomedical history. Then there may be a biomedical cause like tuberculosis or some tumor or something that is causing uncontrolled glucose, or maybe wrong choice of drugs. So these are some aspects we had to share about coping skills. But if there is one slide I would like to share before we leave, that is this simple sentence: motivation is the midwife of action. In our OPD, we get frustrated many times. We keep on telling our patients to act, sometimes to plan, and then they don't listen to us. They don't agree with what we are saying. They don't adhere to our therapy. Then we get frustrated and angry. This creates a vicious cycle of poor communication, poor satisfaction. And the trick is to get the midwife of action into play, and that is motivation. Motivation is the midwife of action, and this is what we all should focus on. Once we are motivated, automatically we will be able to cope with our challenges, and we will be able to teach our patients how to cope with theirs. With this, let's come to our quiz questions for today. So, two questions as usual. Uh, which of the following, oh, and we already have the answers. Which of the following is a primary goal of coping skills training? Reducing stress, improving physical fitness, enhancing memory, or increasing appetite? So that was the first question. Which is the primary goal of coping skills training? Reducing stress, improving physical fitness, enhancing memory, or increasing appetite? And the second question is CST coping skills aims to help individuals avoid all stressful conditions. Is that so? Develop effective strategies to manage stress, eliminate stress entirely from their lives, ignore stressors and focus on other aspects of life. So, what are we trying in CST, in coping skills training? Are we teaching our patients how to avoid stress, develop effective strategies to manage stress, eliminate stress, or ignore stressors and move on to other aspects of life? So, with this brief talk on coping skills, let's see what questions we have for today. Many googly questions today coming up. So one question is from Dr. Vinay Desai, dystonia and ataxia. So there are multiple causes actually. Ataxia usually will be cerebellar. Usually it will be a cerebellar disease, and that is characterized by inability to balance. Dystonia, it is muscular movements which are in trouble, and the etiology can be at various levels of the nervous system. So you might have a very rigid or a very flaccid or variable movements in a particular limb. So that is the basic difference. Good evening to Dr. Siddharth Dhanger from Mathura as well. And Dr. VK Goyal asks about ribelsus. Yes. So there are three formulations of Ozempic, ribelsus, or Wegovy. All are semaglutide. Semaglutide oral is available in India, 3, 7, and 14 milligram. This is approved for use in diabetes, sorry. It is approved for use in type 2 diabetes, and off-label it can be used for obesity, but off-label. Injectable semaglutide is available in two doses, 0.25, 0.5, and 1 milligram. That is the trade name you are speaking about, Dr. Goel. This is approved for use in diabetes. It is not available in India. It is once weekly injection. The same semaglutide injectable, if it is used in 2.4 milligram dose, then it is used in obesity. That is also not available in India as of now. Some of our patients imported from UAE, from Dubai, and they come and tell us that they are using it. In India, if you wish to use, oral tablet is available, 3, 7, 14 milligram. The cost is roughly 300 rupees per tablet. Thank you, Dr. Gauri Shankar sir, for your kind words, and also best wishes for a happy Holi and festive season. Dr. Gauri Shankar shares the case of a gentleman with age 75, no diabetes, lower abdominal pain. Okay. Bilateral renal calculi and vesical calculus 4 centimeter. 4 centimeter is a big size, And I think it should be removed surgically, because maybe they might do it with cystoscopy, or they might do a laparoscopy, because there is lower abdominal pain and patient will be suffering. Uh, Not at this age, but otherwise, if there are so many renal calculi, it is a good idea to rule out hyperparathyroidism. So maybe the urologist or us, we can tell the patient to get test done for hyperparathyroidism. If you can't do a serum PTH, at least do a calcium, phosphorus, alkaline phosphatase. If calcium and alkaline phosphatase are high, then we will think of primary hyperpara. So calcium will be on the higher side, alkaline phosphatase will be high. Even if calcium is normal and alkaline phosphatase is high, even in such patients, we should do proper investigation for hyperparathyroid. Dr. Mitakola Bharat Praveen shares a challenge of a 14-year-old child, normal BMI, GAD65 negative, C-peptide 1.15, which is slightly low, and HbA1c is 12. Duration of diabetes is 3 years. This child should get insulin, actually, basal bolus. We should tell the patient that C-peptide is low. Your pancreas is not able to respond to the demands of the body. HbA1c is also 12. Let us give the medication so that we are able to bring the glucose down. After 6 weeks, 12 weeks, we will reassess again. And if you respond well, we can try tablets or we can try reducing insulin. But right now, we should give basal bolus insulin. Because GAD65 is negative, we are thinking that patient doesn't have type 1 diabetes. BMI is normal, we are thinking that child doesn't have type 2. There is something known as type 1.5 diabetes, so patient can move in either direction. Another possibility, but very rare at this age, is pancreatic diabetes. Very rare. Good evening to Vinayak Sharma ji and a happy Holi to you as well. And okay, another, yeah. If patient has got urea 105 and creatinine 3.5, then this is, of course, probably chronic kidney disease if it is lasting for more than 3 months. If it is acute, that is acute kidney injury, find the cause and correct it. If it is chronic, then patient, this 3.5 creatinine at age 65 is highly risky. Patient should be referred to nephrologist. Apart from all the other medicines that we give, you should give ACE inhibitor or ARB, check for sodium potassium. And there is a drug called finrenone which can be given, 10 milligram OD. But ideally, this patient should go to a nephrologist for care. BOO, Dr. Gauri Shankar, not aware of the full form. If you can spell that out, let me try to answer. 37-year-old lady with HbA1c 8.5 and obese, not able to take glimepiride and metformin. Symptomatic. Easiest would be, because she is obese, to suggest GLP-1 RA. But if she is not able to take metformin, chances are she will get GI distress with GI symptoms with GLP-1 RA as well. So as she has burning feet and is symptomatic, we should tell her, let us give insulin for a few weeks, give vitamins. Burning feet you can correct with pregabalin 50 milligram or something. You can also give gabapentin 100 milligram. These are lower doses. Why we are suggesting is because you are mentioning metformin glimepiride intolerance. So give insulin twice a day, premixed insulin twice a day for short period of time. Once she recovers, I'm very sure she will be able to respond to glimepiride intolerance. I'm quite sure she will accept it after some time. Don't give multiple oral drugs, because patient will keep on complaining of intolerance. Tell her to take insulin for a few weeks. Tell her that we are doing, like you take your car for service to the garage. Let us do that service for a few weeks. Let us fix your burning feet and then you will be fine. And if a dog bites infected person with HIV, hepatitis B or hepatitis C, and then bites 4 to 5, there is a theoretical risk of disease transmission. Yes, and there is prophylactic therapy available for all these, even for HIV, that should be taken. And Dr. Vani Ganpati, Dr. Devraj, thank you, madam, and thank you, sir, for your kind words, and happy Holi to everyone. And to Dr. Armias Gebre-Michel, warm greetings. Dr. Gebre-Michel is an endocrinologist in Ethiopia. Tomorrow we celebrate our festival of colors, Dr. Armias, Holi, H-O-L-I, H-O-L-I, Holi, and we wish you all the best. That's our spring festival. Bladder outlet obstruction. So, of course, prostate is the commonest. Urethral stricture would be another common cause. So, these are the two ones. Dr. Anshul Singh rightly points out that for this 14-year-old child, we did the C-peptide, so it's okay. It helps us motivate the patient. Otherwise, we could have skipped it also. We can give insulin for a short period of time. Counsel your patient that diabetes is a long-term, chronic, longitudinal disease. It is not cross-sectional. So we will keep on treating as and when situations come up. Right now, A1C is 12%. So let us take insulin. While you are treating with insulin, you have to help your patient cope also. So you have to tell the 14-year-old boy how to cope and the parents also how to cope. And that is what we have discussed today. We wish Dr. Armias also a happy weekend. Most of it is over here, but a few hours left in Ethiopia for the weekend. And we wish for peace and prosperity throughout the world. With this, I'd like to thank everyone for having been with us today. Our topic was coping skills in diabetes. And of course, we've learned what we have to tell our patients. But apart from that, we have learned how to cope ourselves with disease. And I hope that this has been useful for all of you. I'd like to thank Team FDC once again for their hard work, their efforts. And we have Ankur with us. So, Mr. Ankur Gautam, did you learn anything new about coping? What will you do
Yes,
now
sir.
when
I
you go back?
strongly believe in the power of thought, and we can also transfer our power of thought. Means just saying, okay, okay, just that you are okay. Okay, so you are transferring your positive energy in that person as well. So we have to just transpire them that they think positive, and so that they can feel better. That yeah, that we can manage this.
So we have a question coming from many people. Every Sunday, you are with us 9 to 9:45 or 10 p.m., right? So
Correct.
how does Mrs. Ankur Gautam respond, and how will you cope with the challenges, the domestic challenges that you face at home because of our timing?
Yes, sir. Actually, sir, the dinner plans are usually cancelled, so we have to opt it for a Saturday plan. So that is one hope that we will go out on Saturday.
Hmm. Okay, so that's a good idea. So see, positivity, a positive answer, a humorous answer, and just shifting the Sunday to Saturday. So that was proper
Yes, yes,
planning and proper action. Yes. So thank
correct,
you, Ankur.
correct, sir.
Thank you for being with us.
Thank you so much, sir, and thank you, sir, for giving such thought-provoking talk on the topic. And I would like to thank all the doctors to take part at in our diabetes essentials every Sunday. And we will again that we will be meeting next week at the same time at 9 o'clock with new energy. Thank you so much, and we will meet again. Jai Hind.
Jai Hind.